how good is the vaccine against the variants?
So I would just mention, go back to my picture, and we do believe that the T cells in particular are helpful in the immunity against the variants still. So at this point, number one, we don't believe, I haven't seen any data indicating the variants or the mutants of the virus are more deadly. And number one. Number two, I haven't seen any data to suggest that the vaccines that we do have, we believe that the vaccines that we do have are effective against the mutants.
So in simplistic terms, we take this ball with the spikes on it, that's our spike protein. A variant is a mutation in the virus, in the viral code. So a mutation is either an addition or deletion in what that, say, spike protein looks like. So let's say we have 20 spikes. We take away one, that's a mutation deletion, or we add one to 21, that's a mutation addition. Okay, it still looks similar enough to our immune system that the immunity that the vaccine induced can still recognize that spike protein. Okay, if this virus continues to mutate, okay, and let's say develops 5 or 6 mutations over the next 2 to 3 years, now we're looking at, say, 25 spikes. That looks quite a bit different. Our immune system can no longer recognize that. So then we may be talking about a brand new virus, not COVID-19 anymore. A mutated coronavirus called COVID-25. And we could enter a whole new pandemic. So if we can establish herd immunity and all be vaccinated, get this virus to peter out, that's much less likely to happen. The virus isn't there, has no one to infect, stops mutating. And
This, what he is describing here is what exactly is happening with the influenza virus every year. And it's why we get essentially a different, and why we get a yearly update of our influenza vaccine, because it does mutate and it does change and it does cause our immune system to stretch it. And so getting another shot in the arm will help prevent that next year from us not having immunity to the current influenza variant that we have out there.
so a lot of people have asked me, Kevin, will we have to get boosters against the COVID virus? So will the people who have already been vaccinated need a booster shot at some point? Currently, the data is showing that, I mean, some people have been 6 months out from their vaccine now. I'm close to 6 months out. And data from the original vaccine recipients is showing that, yes, they still have immunity. Okay. We don't know what that will look like in a year. Will we still have immunity in a year? These vaccine manufacturers will let us know that, okay, going back and testing the initial vaccine recipients. So that's to be determined. We may need a booster, we may not. We may still have that immunity. But the hope was that if, again, I'm going to go back to herd immunity, if we can get this virus to peter out and it's not circulating anymore, then no, we don't need a booster, because there's nothing to boost us against. The virus isn't there in our communities anymore. We don't have to worry about getting sick from something that's not out there. And you made
smallpox is an example of that. We don't get vaccination. Our kids don't get vaccination for smallpox because it's essentially been eradicated from the world, because there was nobody out there for over a period of 10 to 20 years that developed smallpox, because everyone had been vaccinated worldwide. So,
but if we do get more mutations, the fact that we have this mRNA vaccine, that's a quick response time now. We just change the mRNA, we train to recognize a new virus. That can happen very quickly, but we don't want to take that chance, because when I say quickly, 3 months, let's say we do get a new pandemic. We can develop a vaccine quickly, but still, a lot of people will die before that happens.